So the way I tend to think about it is that the status quo sort of primary care relationship is we'll spend 7 minutes with you, and then the clinically correct thing to do is to make a referral because we can't do what we need to do in 7 minutes.
Exactly.
So it actually is the clinically correct thing given the constraints of 7 minutes. But if you remove that constraint, it's like an absurd idea most of the time to make a referral.
Right.
And so again, it's not the doctors, they're not being bad people and trying to mess up the system. They're just like, I've got 6 or 7 minutes here, right? I'm going to do what I need to do. And so, yeah, you if you sort of remove those incentives and you kind of let this introduce better incentives and remove the overhead, then a lot of the time, those doctors that have the ER training, we've got some clients that actually deliver babies, do C-sections and stuff if needed. Like that. That's not necessarily every doctor, but there's DPCs out there that even have some specialty experience that can do. So what we tend to find is that what happens is that really the scope of what is considered primary care expands. So urgent care typically would collapse into the primary care in DPC model. Some specialist care will end up sort of at least the easy stuff, right? Unless it gets really complicated, will collapse into DPC. A lot of the time we have our clients, they'll take the first mile of like mental health, right? If they have patients that are, just really anxious and want to always come and see their doctor, well, that might just be a mental health thing. And often the doctor, if they spend time with them, they can actually help with some of that mental health. Right. And so it's just, you sort of, chronic disease management, if you're a pre-diabetic, well, primary care doctor can help you with your diet, talk with you about your diet and the implications of that and hold you accountable and be available and come up with maybe a nutrition plan. And you don't necessarily need a diabetes-specific verticalized solution that with billions of dollars funded into it. Just let the doctors do some of that work and their teams, or they'll have a health coach part of their team, things like that. And so you just expand the scope of primary care. You do invest more, right? There is a catch, right? It costs more money has to be paid to the doctors to do this work, but it's but it's not 10 times more. It's double or triple, right? But double or triple, and then you're going to get way more than double or triple the value.
Absolutely. Yeah. And ultimately patients and patients have to understand this and be knowledgeable about this and be educated about DPC, because ultimately consumers have to drive this. It's got to be between consumers and doctors, and they are. Once patients know about it, this is why we have you on our podcast. Once we educate them about it and they know about it, they're very happy with it. So,
just kind of references. I saw you threw this up. The doctor-patient relationship is making a comeback. That's kind of the first thing we say on our website.